very first thing is just acknowledging that challenge and saying it's okay for that to be a challenge in this season. There can be a tendency, I think, sometimes to carry too much weight and disappointment in that, or even get into a mode of self-critique, which is something that does come with a lot of mental health challenges. But I think in this moment, it's important to acknowledge that these are very extenuating circumstances. And there's going to be times when all of us are more challenged than before, especially if someone was already on the road to recovery. And I think the other things are the things we've started to allude to already. So being in community with others, being able to share that with trusted people in your lives to say that I'm struggling in this area, and being able to have those people step in for you in different ways, whether that's prayer, whether that's pointing you towards someone that you can talk to who's a professional, whether that's assistance in connecting people with their mental health providers. This is one thing we also allude to. I mean, a lot of things are moving towards telemedicine, but we also have to realize that certain forms of telemedicine are more difficult for some than others, just in terms of access to those services or comfort with those services. So I think it's important to just make sure people are connected to as many resources as they can get to. And I know some of those resources are going to be shared here tonight as well. The National Alliance on Mental Illness has some great resources. There's a crisis text line that people can reach out to. But again, I would say not being afraid to name that and being sure that we have this connectedness with our family members, loved ones, or those who care for us, and then also getting connected to the right professional services if need be. There's no shame in that whatsoever. And there's a lot of heroic component to that as well, being willing to take those steps.